All of us have a lot of questions regarding vaccinations, and today we are going to address some of them. Firstly, what is the need for vaccinations? Every year around the world, 700,000 children die of vaccine-preventable diseases. What are these vaccine-preventable diseases? Let's talk about some of them. Diphtheria, caused by a bacteria which causes severe blockage of the airway and also damages the heart. Pertussis or whooping cough, that causes such severe bouts of coughing that it damages the lung and decreases oxygen flow to the brain. Tetanus, another bacteria that causes painful contraction of all the muscles, thus preventing us from breathing properly. Polio, which causes paralysis and lifelong disability. Rotavirus, which causes severe watery diarrhea in small children. Hepatitis A and B, which affects and damages the liver and may cause liver failure. And pneumococcal and Hib infections, which affect the brain, the lungs, as well as cause otitis media. These are just some of the vaccine-preventable diseases. How do vaccines work? Vaccines are weakened forms of the virus, bacteria, or their products, which in itself cannot cause a disease. But when introduced into the body, stimulate the body, the immune system, to produce more antibodies so that we are protected against the disease. That is, they train or teach the immune system to produce antibodies whenever our body is exposed to these organisms so that we are protected lifelong. How much protection do these vaccines give us? No vaccine is 100% protective, but most vaccines give us more than 95% protection, and all vaccines protect us from the severe forms of the disease. What are the side effects of vaccination? Most vaccines cause very minor side effects like fever, body aches, headache, rashes, pain at the injection site. Some children who get convulsions with fever might get convulsions if fever is high, but this can be prevented by paracetamol. Major serious side effects of vaccinations are extremely rare. Who should not be given vaccination? Children who are immunodeficient should not receive live vaccinations. While if any child that has had an allergic reaction to any vaccine, that vaccine should not be repeated. What are the immunization schedules that are available? There are two main immunization schedules. One, put forward by the Government of India, which is the National Immunization Program, which is available in government hospitals, and the IAP, or the Indian Academy of Pediatrics schedule. So in both, vaccination starts at birth with BCG, OPV, and hepatitis B. And in the government setup, you have vaccinations at 6, 10, and 14 weeks for diphtheria, pertussis, tetanus, Hib, and hepatitis B, which is the pentavalent vaccine, along with the oral polio vaccine, as well as the rotavirus vaccine. In addition, at 6 and 14 weeks, you get the vaccine against pneumococcus, as well as the injectable polio vaccine. At 9 months, the MR vaccine and the JE vaccine are available in the health centers. 16 to 24 months, you get the booster doses of both MR as well as DPT, together with the JE2 vaccine. At 4.5 to 5 years, you get the second booster dose of DPT and OPV, and at 10 and 16 years, you get the TD vaccines. In the private setup, according to the IAP schedules, there are other useful vaccinations that we can take. These include the influenza vaccine, which is given at 6 and 7 months of age, and then yearly in the pre-monsoon period. The second one is typhoid vaccination, which is given at 6 to 9 months of age. Third is MMR, which is measles, mumps, and rubella vaccine. As you know, there have been multiple outbreaks of mumps in our schools, and this mumps vaccine is not available in the government sector. So the IAP recommends 3 doses at 9 and 15 months, and the third dose at 5 years of age. At 1 year, you have the hepatitis A vaccine, and the second dose is given 6 months later. At 15 months, you have the varicella or the chickenpox vaccine. The second dose is given 3 months after the first dose. The other vaccine that is available is the HPV or the cervical cancer vaccine, which is given at 9 to 14 years of age. 2 doses are given 6 months apart. I know that these schedules sound confusing, but they are clearly laid out in the vaccination booklets that you receive both from the health centers as well as the private hospitals. I have come across many patients who do not take vaccines either because they do not believe that vaccines work or are scared about the side effects. But vaccine preventable diseases have not gone away. The COVID pandemic has taught us that vaccines help to prevent severe disease and death. I would strongly urge these people to read about the science behind the vaccine and understand that these diseases can cause severe illness and even death. The vaccinations that are available to children today have a long record of safety and efficacy, and they also protect the community as a whole. So let's join together and pledge to vaccinate our children, because our children deserve to be healthy. Thank you.